I think veterinarians in all walks of life have something to give our future generation of students. If we can do that in a way that empowers them and makes them stronger, I think that's even better.
Today's episode is proof that neurology, like this entire podcast full of veterinary careers, is full of possibilities you can never imagine. Not long ago, a guest on this show mentioned that neurology had caught her attention in vet school. But when she looked around, she only saw the neurologist doing surgery, so she went a different direction. I thought about her when I sat down with today's guest because Dr. Ryan Gibson's career in veterinary neurology looks very different from that perspective. Ryan knew he wanted to be a veterinarian since 4th grade, thanks to some early mentorship. He discovered neurology in vet school when it finally clicked during clinics, and then built a creatively diverse career that allowed him to find fulfillment. You probably found your calling if you're describing reading an MRI like opening a Christmas present. He is a passionate educator who has a hilarious early childhood story that foreshadows this part of his career. And today at Auburn University, he is teaching neuroanatomy, supporting clinicians in practice who can't refer traditionally, partnering with research across campus on everything from translational neuroscience to AI in veterinary education, and running faculty development workshops that are changing how educators across STEM disciplines think about teaching. He has a master's in adult education, he does improv theater, and he built a consulting practice specifically to support pets and families who might otherwise never have access to a neurologist. If you have ever thought that neurology or academia or specialty medicine had only one shape, this episode is going to change your mind. Let's get to the conversation with Dr. Ryan Gibson. When did you know that you were interested in veterinary medicine?
4th grade. I had an amazing 4th grade teacher, and they did some team teaching in 4th grade. And one of those teachers, her husband was a veterinarian. And he brought in some of the coolest things that he had ever taken out of dogs from foreign body surgeries, had their x-rays. And so I credit Dr. Scott Yancey for being that impetus for getting me started in this career path. He continued to let me work with him when I was in high school and kind of going through the FFA program and some of their co-op type programs. And so he kind of helped me go from that 4th grade little kid who was just excited and saw all the amazing things being done in veterinary medicine, and then really kind of was that support and that mentor going through that process in high school and saying, okay, now I'm really going down this career path, going in, and a lot of that foundation pointing me towards the University of Findlay, and then just, snowballed from there. So yeah, 4th grade.
Well, awesome. So based on that, was he a mixed practitioner?
No, he was a small animal.
Well, just small.
Yep. He was a private practice owner, focused heavily on the small animal, but, did some advanced procedure surgery and things like that. And so it was really cool to see kind of how he owned and created his own space in veterinary medicine.
Yeah. Well, the reason why I wondered was because when I asked you about your initial thought of how you might be a veterinarian, you had said mixed animal. So I didn't know if that was where that came from.
That came a little bit later.
Okay.
That was actually, I think, being the future farmers in America, that agricultural world really showed me like how we do need people to fill those spaces. And I was like, oh, I can definitely do that. I can go down that pathway. Took a lot of those courses when I was in my undergraduate. And so to me, it was always something I was in a high appreciation for it. And then working through vet school and all of these things, found my passion for neurology. And so I'm still thankful that I get to go out to the barns from time to time and play with our large animal teams, because it does kind of fulfill that component of it. But I really just fell in love with the ability of using the MRI and proving my localization and dealing with some of these really atypical cases in terms of neurological cases.
Yeah, a benefit of being in academia is there's everything there, so you can go explore whenever you want to. And I think I remember you telling me too that, and this may have been even before 4th grade, but you had early signs that you were destined to be an educator, a teacher of some sort.
Oh, yeah.
You shared some stories.
Yeah. So that side of me. So my dad was always in community education, and then later on shifted into the true K through 12 space. So I've always had kind of a little bit of that educational nature. But what really showed that was when I was young. I have no idea where this was in the timeline of things, but I would give my toys and stuffed animals and things like that quizzes and tests after teaching them something, right? If they failed, I threw them out the window. Now, the good news is teaching strategies have changed, but love for teaching has not. But that was one of the first things. And that's always been something that I've carried through my entire career. I've always had that passion for educating and working to inform, to create new knowledge. I carried that with me through high school and helping with Boy Scouts and working as a nature director in the summers. And so those were all things that I had the pleasure and opportunity to engage with and kind of nurture that educational spirit. And that has just carried on now through my career
Well, both loves, whether it's education or even veterinary medicine, there's so many things that you can do with that. And so
so much.
here, here's your opportunity. So you said it in vet school, you had lots of different ideas and you found neurology. So how did you
I did.
discover neurology?
Yeah, so it's a little bit twofold. For me, I love this idea of being able to take what a patient is showing, right, and say that's the exact location where the problem is. I tell my students all the time, neurology did not make a lick of sense first year when we're going through the anatomy, measuring all these pathways. I would love to say that I was a neurology savant, but I was far from. But it was once we were got into the clinical space, and I had even fourth years teach me kind of going through the neuro exam early on. And that was one of the benefits of Mississippi State is we were in the clinics a little bit earlier. And so I was able to talk with senior students who felt really comfortable with it. And one day it just clicked. Going through a case, I'm like, whoa, all of this now makes complete sense. It's locked in. And then for me, doing an MRI is like opening a Christmas present. You're like, you shake it, right? You're like, I think that is what I wanted. But then you actually get to open it and look. And that's kind of the joy and the excitement that I experience when we do that. Now, the flip side of that is, you know, in the world of neurology, we spend a lot of time doing that, but we spend just as much time handling cases that don't have that option. I do think that's something that gets a little bit missed or mistranslated. And there are neurologists out there who they only will see cases that are going to go in for full workups because they're so busy. And I think that's where I've kind of blended kind of my triad of my career now is the clinical component is heavily focused around talking and supporting veterinarians who have cases who can't refer them and making sure that those patients get the support. Because I grew up, I tell people I didn't have no silver spoon. I had a KFC spork at best in my mouth growing up. And so I want to make sure that community, that people who maybe can't go down these like multi-thousand-dollar workup pathways still have support and access to a neurologist. And so that's been a really fun component of how I've approached this new way of practicing medicine whilst also focusing in on the education side. And that's my current position has just allowed me to explore and kind of find the best pieces of the education space, the clinical space, and then working kind of in that, some neurology research and things like that and supporting research as well. And so it's just been a blend of all what I tell people is the fun parts of the jobs. And, again, it's not only the best parts. Of course, you still deal with all the tough cases, right? Especially as neurologists, I'm seeing these epileptic cases who are on 4 medications and still not responding, right? So it's still kind of that same burden that we all have when we care so much about our patients and the treatment doesn't go the way we want to, right? We carry that with us. But I think that there's pros and cons to that, right? It's because we care so much, we feel that way, right? And I wouldn't want to not feel that way.
Yeah.
So, but yeah, so it's been an adventure to kind of create something that's atypical.
Yeah, absolutely. And that's what we're all about here is talking about those opportunities to kind of create what makes sense. So, if you're describing an MRI, like opening a Christmas present, you're on the right track. So,
Correct.
and thank you for acknowledging that textbook neurology did not come immediately to you. There's hope for all of us that
Yeah.
struggled with textbook neurology as well.
Absolutely.
But you make a good point that there is something about neurology of finding a lesion by a physical exam that a general practitioner can do and help and
Absolutely.
make sure that all patients still have really great care by our bread and butter physical exam and, history taking. That's great that you are emphasizing that part. And I think that's what we're trying to lean into more with training DVMs is to be really good general practitioners and leverage the skills that we can have, the range of skills to be able
Mhm.
to support all pets that come to us or as much as possible.
Absolutely.
Well, I know, like you said, you've been able to do a lot. And I think you started, where did you do your residency? In Ohio?
Mississippi State.
Oh, Mississippi State.
Mississippi State. Yep. Yep.
Oh,
So my
right.
internship was in Ohio
Then I know.
State. Then I went to Gulf Coast for a neuro internship, and then back to Mississippi State for neurology neurosurgery residency.
Yes. And then
And then back to Ohio in private practice.
it's okay. A lot
Yeah.
of specialties, you end up like going all over the place.
Lots of bouncing.
Yes. So
Yeah.
you started in private practice.
You're correct, which is enjoyable. Pros and cons for sure. I enjoyed the efficiency. I enjoyed the ability to get in, do the thing, and get out, and we're able to see a lot of patients in the same amount of time that, I think academia is a little bit slower in that regard because we're taking that time to hopefully teach and engage with the students and all of those things, right? And so there's kind of that flip side of like, I love the efficiency, but I never got to nerd out with anyone ever. And of course, I had an amazing group of technicians who wanted to learn and engage. And so we were able to feed into them. We had some house officers that we could train. But again, it just wasn't the same environment. The whole environment wasn't about that. And I know that there are private practice groups who are really focused in on saying, hey, no, we're going to support that educational development and that passion for learning that other people have. I think it was there to some degree, but at the end of the day, it was also like, okay, let's get things going. There was for me a fundamental piece missing. There was that internal foundation of, okay, I definitely feel like I belong in an academic environment.
And I think you also said you had an injury around that time too. Was that also
I
kind of a
did.
push?
Yes and no.
Oh,
There was definitely a hand injury component that took me away from her a little bit. It definitely required a lot of internal thinking about like, okay, what am I doing? Do I want to keep doing it the way I'm doing it? And I have full functionality back in my hands. I can feel everything. But it was one of those you're like, man, once I was gone, because I was a solo neurologist, once I was out, the service really suffered. And there was not a team-based approach where I could still engage, provide, and things like that. And so it was one of those things where like, man, I'm doing this all by myself. Maybe this isn't the right way to be approaching it, right? And I often tell people like neurology is a team sport. And if you see people out there doing it solo, I got mad respect for them. Because it does take a lot. And one physical day for me was multiple months of time that I could not function the way I needed to. I think that played a big role of being by myself in that domain, that I felt very isolated from other neurologists. And there really wasn't this collaborative nature that I could engage with. I mean, certainly there was in terms of talking with radiology, talking with internal medicine, like that collaborative component was good. But then when it came down to the neuro-specific questions, like how do we talk this out? What if we did that? There's just such a beauty that happens in that I really could not get in private practice, and it was going to take a while to bring somebody else on and get back to that level of where I was saying, well, veterinary medicine played a role in that. And so I think the injury definitely was the impetus for saying, okay, maybe it's worth looking at. Am I truly happy? Am I truly getting fulfilled in this career? And so I think it provided kind of the impetus and the space to start asking those internal questions. Because I definitely, when I had that hand injury, came with a lot of depression, because I've tied so much of my identity to my career, right? I was like, well, now I can't do that part. Who am I? And it just showed how much my life was entwined into being a neurologist. I think part of that may have bothered me a little bit more than I let on. And so I think that's why things started questioning. And I started talking with professionals and think, hey, I feel like a trash, right? Like I am not in a good place. And it was really scary for me because for the first time, I really kind of understood how people get to those dark spaces.
Mm.
And I think prior I'd really struggled with that. But that was the first time where I was like, ooh, okay, maybe this isn't so hard to get to. And so I think all of those components said, okay, Ryan, what brings you joy? And had a really great relationship with one of the people that I was working with in terms of talking about what brings you that true joy, what brings you fulfillment in your life. And so we started talking kind of about that, the history components of being involved in education and how much I enjoyed doing that component during residency. And I give complete credit to my residency team and director and advisors who really allowed me to engage in that educational side. And I think that just really helps me develop that passion at the professional level for it. And so, yes, a lot of many factors that allowed me to kind of give a space for saying, Ryan, are you happy? Are you fulfilled? And if that answer ended up being no, which it did, what do you have to do to make that change?
So what did you do? Did you start
Yeah,
looking? What did you do?
I did. I started looking and I was looking for academic type roles. And it was a little weird because I was like, I wanted a role that was a little bit flexible and unique. Which isn't very common because, I think we, even in the academic world, we have roles that are very set, right? Neurologist does this, surgeon does this, researcher does this kind of thing. And so I was looking for kind of these more unique roles that maybe were a little bit more educational heavy and just happened to come across one at Auburn that was for kind of a lecturer in neuroscience as well as some microanatomy and a focus on saying, hey, we want you to come teach. And then what you develop on the other side of that, in terms of what you do with the rest of your time, is kind of up to you. I said, well, that sounds kind of nice. And so I went, interviewed, and I was like, wow, there's a lot of opportunity here. And I think that opportunity kind of equated to that part of here is where you're going to be in the academic space. You're going to be heavily engaged in first year curriculum, a little bit in that second year. And then you get the space to develop and create. And for me, of all the positions at the time, this one was founded in a well established vet school and had some of these other really supportive main campus teaching things to where you can create and develop as an educator. And so it was just a perfect kind of light of opportunity. And sure enough, I was able to come in and serve primarily as an educator and then still going to go down and support the clinic. One of the things I did not anticipate in this academic role was the ability to support and work with so many amazing researchers and provide kind of that veterinary support for a lot of our research teams and new drug development, translational imaging. So kind of how old is a cat in human years and vice versa. And, what is the more scientific side of that rather than just kind of some of these, myths and poor information out there that we have, dog age of 7 years, what, right? Like, how do we scientifically align that much, much stronger? And so I've been able to really engage with a lot of those researchers as well as researchers in the space of education. And that has been kind of the unexpected portion of this. I knew coming in, I'd be on teaching and doing the education. I'd be able to play a little bit in the clinical side. And it allowed me the space as well to kind of create this consulting company that allowed me to engage with veterinarians who have those patients who can't refer traditionally and give a little bit more, a higher level oomph with reports and things like that, dedicated times to talk. And so that has been great. Again, it allows me to help those pets and I feel maybe haven't had the opportunity and the chance to get a neurologist involved because maybe they couldn't physically travel, maybe they couldn't afford it. And so I think blended in, and there's a need for that, especially right now, right? We've seen those spectrums, and I wanted to be kind of in that middle one. And I think this has been great, and Auburn has let me do all of that with such amazing support. And so, kind of like I said, I have that education side, that clinical side, and then this consulting side and research side that has kind of created just a nice little bit of everything that I can do.
Well, it's just so funny because I was talking to someone not long ago and they were telling me their journey and they said, in vet school, they had 3 different specialties that intrigued them. And one was neurology, but all that she saw the neurologist do were cutbacks. And she didn't
Yeah.
want to cut backs for her entire career. And, it's just so funny listening to you. And I'm like, there's so much more you could do. Now, if you love cutting backs, by all means, I'm sure that
Plenty of them out there. Plenty out there.
but there's so much more opportunity.
Yeah.
I love that you're working across campuses, so not just in the vet school, which I'm sure there's plenty of opportunity there too, but you're doing a lot with the main Auburn campus as well. So
Yeah.
STEM research in general and STEM education is all part of what you do.
Yeah, no, it has been a fun and unique opportunity to be involved in both educational research as well as some of the faculty development programs. Because I think by developing our faculty, we're also serving our students to make sure that there's, it's not just, hey, there's 1 or 2 people who always do really, really well with the students. I would make sure that the entire faculty is, and if nothing else, helping support them with here's the resources, here's some of this background stuff, right? There's so much we ask these faculty to do, so much. And so the more that we can kind of package that up and deliver it, I think there's a lot of benefit for all faculty across the main campus. And so in the educational research space, we've been able to do quite a bit looking at less of like how we're going to use AI and more of like what's important. What should we be teaching the students and what do we need to be focusing on in the curriculum? How do we take what we're already teaching with some of these informational literacy components of, okay, how do you critically evaluate an article, whether it be a journal, whether it be a YouTube video, whether it be a TikTok, right?
Ooh.
All of these are mediums of information and they can all be held to the standard of critical evaluation. And so what we spent some time doing was looking at the research of, okay, what do people in academia and private practice, what do they want us to be teaching? And we mapped into those operational, here's how I use the AI, here's how I prompt, right? And here's how I ask the questions. Here's how I understand, is this a large language model? Is this machine learning? Is this deep learning? What do those even mean? And how do you create it? What is the black box component? Who is sharing the data? Who gets the data? A lot of these deeper level critical questions that we apply to new information all day, every day. If you go to a conference, right, you're going to critically evaluate the speaker and kind of all of those different things. People come in and say, okay, is this information I'm going to use in my practice? And I think we can apply that same thematic and framework to AI education because it's growing. We know it's here. There's a little bit of a tech nerd inside of me who enjoys talking about these, but also nobody can do it by themselves. And so I've been lucky to partner with groups at North Carolina through our Southeastern Veterinary Education Consortium. So we just get a bunch of people who love to talk about veterinary education together. We have different subgroups. So like that one's on artificial intelligence and North Carolina has led that group. And we talked about how does it impact students? What do we need to make sure that they leave here knowing? And it's been a lot of change and academia is slow to change. And so this AI has really forced us to kind of accelerate some timelines outside of what we would normally do. But I think that's a good thing because it means that these schools are growing and changing with the world around them. And I think a lot of people think that academic institutions are often immune from that kind of change and that we're slow and lag. And there's some truth to that. But I think in this area, we've seen a lot of people jump on it, but also be highly critical, right? And that's what you want from your academic institutions.
Mhm.
We want to know what degree can we trust it? How correct is it? And how does this compare to other modalities, right? And I think there's a lot of benefit to that critical component of critical evaluation. And so it's been fun to kind of work in those spaces, work across multiple institutions on some of these projects that we did in Tennessee and Mississippi State. We've had this domain group with North Carolina and a couple other schools engage in that as well. And so I think those community conversations have been really, really powerful. And I did do a master's in adult education just because I wanted to have a better sense of how do we teach the adult component. We're really good. We're really good in academia about teaching learners who have come through the K through 12 system, moved into higher education, did their undergraduate, right? Well, how do we take that and how do we move that into the adult space, right? I'm out here, I have a job, I have to perform and all of these things. And so that was an amazing experience that I got through our main campus. And it focused around multiple domains. So it wasn't just vet med. And I thought this was beautiful. It was vet med, it was nursing. So people who do a lot of diabetes education and nursing ed was amazing. Military education. There was sports ed. So there's a lot of people from a lot of different backgrounds that we got to come in and share different approaches to how we train and how we educate people who are in these job specific professional domains. And you'll hear a lot about that in the education space, about competency based education and things like that. And some schools have a very aligned way that they do it. Some schools say it's all in our curriculum. It's maybe just not as formalized. No right or wrong answer. But what's important is that we're focusing on creating these educational experiences. And I think that really gave a sense of, okay, we can create them, but how do we critically evaluate them? How do we make sure they're good experiences and not just experience on paper, but something that people can leave with? And I think that's a really, really great thing, especially in the continuing education space. If there's one thing that probably hasn't changed over the last 30 years, it's how we deliver continuing education, right? And I think some of that is driven by some of the restraints of how we define continuing education and what gets approved, doesn't get approved. But I think we're starting to see more of this idea of like these workshop type approaches, this active learning type approaches that are being more accepted. We're seeing more labs now than we ever have before. We're seeing different frameworks. And so it's been really exciting to kind of watch that and then hopefully try to apply some of that into my own CE type teachings. Because I think this is a huge space. And if we move out of the vet med world completely, and this is where there's just a ton of fun. So this entire last week, I've been on main campus working with our college of science and mathematics and our STEM-based fields. And we brought STEM field from all over main campus together, and we looked at faculty development, focused around on active learning, saying, hey, how do you take a lecture, but how do you add a little something to it, right? How do you re-engage the students? How do you do an active learning? How do you put them in the driver's seat for learning, right? And start this idea that if you really want to learn, you have to own your education. Mm-hmm. And so there's a lot of discussions about how do we do that and how do you shift it from performing as a educator to facilitating education, right? And it's much harder than just saying, hey, here's an activity, go forth, right? Because if we don't have purpose behind those activities, if we don't know why we're doing them, then we shouldn't be doing them, right? And that's a lot of great things. We can apply that to medicine. If we don't know why we're doing the surgery, we probably shouldn't be doing the surgery. Same thing for education. You can have a really cool activity that does nothing to move your students forward or does nothing to challenge their knowledge. And then making sure that we're aligned. And we spent a long time about aligning because I can remember having a professor who put everything up on the board and just lectured nonstop for an hour. And then I wrote just specific notes and read the chapter, and then none of that was on the test.
Oh.
And it's really, I think that's one of the things for me as educators, like to have someone say, hey, we never talked about this. Now, there are experiences where people say we never talked about this 4 years later, right? There's a large gap of time that I can appreciate that. But we didn't talk about this on this specific test that you gave me over the last 3 or 4 weeks, right? I think that there is that component of like, we need to make sure that we're aligning what we're lecturing or what we're creating these learning experiences about with the outcomes that we want, which requires work and effort, right? And that requires time. And so how do we create some of these strategies where we can deburden some of that time-based components rather than recreating the wheel? Can we identify frameworks that are already out there so that we can modify to our purposes? Those are things that we've kind of spent the last week talking about. And it's been really cool. We've practiced creating learning activities that are quick 5-10 minute type things that you can put inside of your lecture and finding that balance of does everything have to be said out loud? So it's just great. And if you love to be nerdy about education, what a fun way to spend a week. I'll have a great time. And we're sharing it with a lot of young faculty too. So a lot of the postdocs will come, some of the PhD students who are kind of saying, I think I might want to create a career in academia. Kind of just showing them that there's more than one way to do it. And I tell them, if nothing else, you've been exposed to multiple ways to teach. I think that's powerful because what you want to have in your toolbox is multiple ways to engage your students, because one way does not work for every single student. And that doesn't mean we're going to get rid of the lecture. I think that's what a lot of people think. Oh, lectures are dead. There's a lot of benefit, especially for content delivery, right? By God, tell you what, after 5 hours of lecture, I'm dead as an audience member. I can't. And if we can create these little tiny interactive learning things. And so that's what we spent the last week talking about with our main campus center. And it's been really good to engage with them and see it from other disciplines, not just vet.
Yeah. Is there a particular example that you did, like an activity or something that just might be interesting for people to
Yeah. So what I share with is one that I created for this week to kind of demonstrate what we would be doing. And so one of the things that I find that our students challenge with is the cranial nerves. Because if I take the brain out of a cadaver, well, I'm going to have to cut the cranial nerves, right? So then you don't get to see the connection. And then there's a lot of holes inside of the brain that were, like, what are all these numbers and names? And our residents do this as well. And so what I did is I took a skull, 3D printed it, modified it so that the top of the skull was removed. And what we use is some of the content from our anatomy lab, and they run pipe cleaners through the holes in the skull. And then they tag the name, like what is the hole on the inside that this goes into, what is it outside, and what nerve is running through. Then I like to take that a step further, and I say, great, now we're going to give this animal cancer. And so I'll take and make a tumor behind the eye and say, okay, what now deficits would you anticipate for this retrobulbar tumor? Maybe I'll make it a cranial nerve too and just wrap it around the cranial nerve. And so they have to look at that. They have to investigate it. What were all these pipe cleaners? They're all color coded. What do they mean? What are the neuro exam signs associated with it? I'll take that Play-Doh and I'll move it there. I might put it back here behind the bulla and give it some of the cancer that will affect the vestibular system. I might even put it inside and do a cavernous sinus where they can see that all of those extraocular, intraocular muscles, a little bit of the facial sensation muscles are running through that cavernous sinus. And again, what are you expecting to see on your neurological exam? So kind of flipping it from what we see in the clinic, right? We're like, here's the clinical signs. What could it be? Here's what it is. What are you going to see on the exam? And so usually it's not one that we will do. I just kind of created with my mindset of this would be for my more advanced neuro elective, someone who's kind of gone through and understands the localization, the neuro exam, and can kind of spout that. But I think any first year could take the first part of that, right? And understanding the holes in the head and how they relate and where the nerves run. A second, third, fourth year, they are the ones who can then apply it now to this clinical backwards space of saying, well, now I got the tumor. What am I going to see? And I think that there's a lot of benefit in that. And so that's one example of that kind of active learning that, if I want to make it super short, then I pre-do all of the cranial nerves and I just do the Play-Doh part, because that cranial nerve part takes a hot second to do. And another one that my team created, we were very plant-based heavy. They were trying to show how teams work, because one of those mindsets is that, oh, individual can do it all by myself. Well, she shared a really cool story about how, in essence, Auburn saved Tabasco. All right, and I'm being a little broad, but the main pepper that was used in that was undergoing some really severe environmental stressors, changed, and in essence, they were going to run out of peppers. And so what we did is we created kind of a character card game, think Pandemic, where you have a bunch of different characters, or if people are into tabletop role-playing games, those kind of character cards, where we said, okay, this is the role that they play. So statistician, plant breeder, we had a horticulturist, we had an agronomist, we had a PhD student. So we created these characters, a little bit of a synopsis of what they did with their job so that they could kind of associate what are the different careers and how are we going to do that. And then what are some facets about these individuals? Some people liked coffee. Some people studied entomology as a minor or a secondary major. Kind of these things that put together personalities. So it wasn't just, oh, I need an agronomist. I need someone who's in soils. It was this idea that, well, there is the job part of it, but there's also, you have to create and think about what's the team dynamic. right?
Okay.
If you've got two people, like I think we had a married couple in there, we had a couple who had worked together before and it didn't go well. Like we put in some team dynamics so that there was this ability to go through. And then they had 9 or 12 cards of characters and they had to create a team of 5 to go and solve this. And I think we had it where Auburn was wanting to have orange. I can't think of the flower name, but an orange type of flower at hydrangea because an orange doesn't exist. I learned, and so we were going to have an orange hydrangea. And so they talked about what would it take, who would have to be involved, and that was the team that they were developed. And then there was a coffee beetle crisis where basically there was some agri-terrorism, and they released beetles in South America that started attacking the coffee plants. How do we create a plant that was resistant to that, and what team members need to be involved? And so that team member plans to use it early on in her plant breeding course and say, look, guys, you're not going to do it all by yourself as a plant breeder. Don't think you're going to. And so she shares that example of kind of how Auburn used multiple people. I think one person was from Clemson and a couple other people from around the country that came together and said, hey, we need to create a better pepper plant for this because the environmental stressors that are occurring. And they did. They created one that was better, sweeter, a little bit hotter, prettier. And so it was just a really cool example of how many people it took to create that. And so what was really amazing was watching all these STEM educators go through and be able to have these conversations about, well, why this person? Why not this person? And it was one of the things you're like, wow, guys, this is real life. Like at some point, you're going to have to create a team.
Mm-hmm.
And so this is like a real life skill that they're getting from playing cards, and we did leverage artificial intelligence to help us create that because we didn't have a lot of time. It was kind of one of these 24-hour challenges where you create a problem and you have to come up with a solution. And so we used it and we used a lot of prompt engineering to tell exactly what we wanted the cards to look like and then let it create. And it went really, really well. We even inserted some of our faces into the characters.
You had real
Just for
fun.
that little extra. Yeah, we did. But again, and I think that's, finding the fun and that passion. One of the things that I struggle with bringing that back to vet med, right, is how busy we are,
Mm-hmm.
especially in academia. Is, we ask them to be clinicians, we ask them to be researchers, we ask them to be on committees and things like that. And so I recognize the difficulty of doing this. And so trying to take it where we can chop it up, put it into smaller tidbit pieces that they can take with them. That's something for me is like, okay, my what's next is how do I bring this to other faculty in a way that is very doable in their very busy schedules. I think the other beauty of this is trying to disseminate information out to our fellow veterinarians who engage in education, but maybe aren't formally with an academic environment. We're seeing more and more veterinarians be involved in the education space than ever before, especially with a lot of the new schools popping up. And I think that's great. I think veterinarians in all walks of life have something to give our future generation of students. If we can do that in a way that empowers them and makes them stronger, I think that's even better. And so that's kind of the what's next for me is how do we take really these cool concepts that we take a week-long course to do on main campus during the summer, and how do I translate that in something that's usable and has really profound takeaways for people who maybe don't have that whole week to give. So that's my what's next for that.
Yeah, and you make a good point that there's more and more opportunities that if you are interested in education, but the clinic calls you, like there are more opportunities to do both.
Yeah. A lot of ERs are doing their different education programs. We've seen a lot more of those certificate or those mini credential programs come around. There's a lot of opportunity if you have kind of that passion for education and veterinary medicine. No, but I want to stay in a clinic setting. Like I want to be primarily clinician. There is so much opportunity for that education space. It might be on a smaller group, but sometimes those smaller groups are more powerful than any large group teaching that you can do.
Mhm.
And so I think some people don't relate this idea that, oh, I am an educator because I only maybe teach 2 or 3 students at a time. That makes you potentially one of the most effective educators. And so make sure that we can empower them with tools and resources to be really good educators. I think there's a lot of potential for that. And so that's one of the things I've been working on with main campus. How do we bring this back to our faculty and staff in more tidbit situations? And then how do we package that up to make sure that it is more applicable to a broad audience of healthcare professionals and educators. Because the human world has this exact same thing. Pharmacy has this exact same dentistry. They all have these same things where there are these students that are going out, and we have that. We have students that go out and do their clerkships, right? Is there things that we can provide those people to make sure that they're more effective educators? And for me, that's always the question: is what do you need, and how do we create it?
Well, the groups that you talked about, you said that there were some different universities that you had been working with on like AI topics, things like that. Are there results or outcomes that if people are interested to learn more that they can go?
Yeah, so we've published in the Journal of Veterinary Medical Education. And I think that's where a lot of people who are kind of in that education space are spending a lot of time. And so, in terms of publishing, and so the Journal of Veterinary Education, Medical Education is a great resource. The American Association of Veterinary Medical Colleges is another one who has different task groups and things. They've really been talking a lot about the Spectrum of Care initiative. They have a smaller AI footprint compared to other groups, but it's out there. And then there's other groups that focus on different regions for education. But I think what's nice about JVME and AVMC, those because the AAVMC owns JVME, that was a great resource for kind of education. But I'll tell you, a lot of us, when we're looking for educational things, we go start looking at nursing, pharmacy, because they're so much larger. They have a lot more resources. And I'll tell you what, the nursing group, there are some darn good educators in that world. And so a lot of the things that I have kind of been interested in or I've seen others do on main campus, nursing is often there, pharmacy is often there. And so I think those kind of areas of looking for more resources on how to be an educator, how to develop those kind of things are out there. There are a couple veterinary education, masters of education programs. If you want a more formal approach, the Royal Veterinary College has one, Lincoln Memorial has one. So there are places that have these veterinary medicine specific veterinary educator programs. Well, I've heard that there's new programs on the way, kind of in that domain as well. And yeah, I think for me, I wanted actually to have a multidisciplinary approach in my master's. I also work for the university, so there's a financial benefit, right? Like, don't go paying something when you get it home for free. And so I think there was a strong benefit for that, but I'm really glad I did it because it is multidisciplinary. And so I think it kind of depends on where you want to be, but a lot of the foundational teachings are going to be very similar, right?
Yeah.
Like, what do our students need? What does it mean to learn? What is that processing? And so I think that's kind of that higher level of that. And I will say, I'm seeing more and more CE around these topics. And so kind of keep an eye out for that. We were at ACVIM last week. They used to have a really heavy presence for education. And so keep an eye out for that when you're looking through the different CE programs. Look and see if they have either a track or just a couple special lecture topics on active learning, being engaged in the classroom, teaching in the clinical setting. I think those are all ones that I've seen kind of be put out or been a part of creating. And I think they're important because we're seeing more and more people who engage in that education space, but maybe don't wear the head of educator because they don't feel like they've been duly trained. Here's the big secret, y'all. None of us have, right? Unless you go and seek out that extra master's you're developing as a faculty member, that's something that kind of develops over time in the traditional setting, right? Now we're seeing more people go get the formal training, do the masters. Some schools have brought in just amazing educational psychologists and instructional designers to support faculty and help educate them on some of these best practices or help take off some of that like theoretical burden of like, well, what's the best way to do this? Or kind of the analytical components of their test questions and things like that. And I think that's a beautiful thing to partner with all of these people. And so there's also a great network called the Pod Network. I often follow them. That is an education specific. So you're going to get a lot of stuff about instructional design, things like that. So it may not be for everyone, but again, kind of that multidisciplinary approach of just seeing what the education space is doing. That's where I'm usually following the group.
I love all of those resources. I'm very excited about what you're doing because I mean, you listed out so many use cases, everything from how to choose a team to,
Yeah.
internal education to teaching our clients better. I'm hearing a lot of communication skills in that as well.
So much. Yeah.
What you're doing has so many potential impacts that I'm very excited for all these resources and that how people can use them. And I am a person that loves multiple perspectives. So I like the idea of learning from other industries and helping us think outside of the
Yeah.
box, which encourages more creativity on how we can apply this in different ways across the board. So this is super exciting. I admit I'm one of those that I'm like, oh, academia is so slow. So I'm glad to see that, no, you have that opportunity to lean in and really enhance, work across the board on
Yep.
how to keep education moving forward, both inside the university, but also you're bringing that out into other areas of as well that all impacts veterinary medicine. So I just want to thank you.
Absolutely. Well, and the one thing I want to make sure that I take the opportunity to say, I'm not doing it alone. And that's such the key. Everyone's like, how do you engage in this education experience and do this? It's because I work with some amazing people, and being able to highlight everyone's strengths and lean in on their strengths and be honest about what my weaknesses are and where I need others to complement those weaknesses. That self-awareness, I think, really comes into play as we do it and recognize that we all have strengths, we all have weaknesses, but we can all create teams around us that have really strong areas that we're weaker in. And so, yeah, none of this I'm doing alone. I get to do it with amazing people all day, every day, researchers, clinicians, administration. I often tell you, I was like, I think most of my job is just bringing the right people into the room and then moving forward, because I think that is so vitally important. But then also place that if you view education as the ability to create, for those that maybe lean on the artistic side, which I do a lot of theater, a lot of improv, for me, the education component is how can I professionally bring in that creative nature? And there's a lot of play for the creativity side that I think a lot of veterinarians we sometimes repress
Yeah.
more than we should.
Hmm.
I know that when, going through residency and working out private practice, I didn't do anything with theater groups. And there's a whole chunk of me there that was like, wow, I'm not doing anything creative with my life. I'd get excited when I got to make an AA bandage around the neck and we got to do some arts and crafts because they were too tiny for the commercial event. I was like, this is great. And so I think that if you are creative, there is space in that education side to create educational experiences. It's always that balance though, like how do I create this educational experience that is meaningful? And what is the purpose? Why am I doing it? And so I think by just kind of having those trainings, you get in that mindset of like, oh, I could create this really cool thing that takes 8 hours to do. And they learned nothing from it, right? There's a balance to everything. And so just being in the education space and talking about that. But yeah, if you have a creative side and you're feeling that you don't get to express it, blending it on the education, it can do some really cool things to fulfill that part of you as a person.
That's a very good point. I think a lot of people forget that part of, and I think you even used the phrase, the art of medicine or art of something.
I do, yeah. I call it the art of seizure therapy, and it's so true.
Yeah.
So
Well,
true.
awesome. Well, thank you so much for your time. I love to end on one final question, and that is when you think about gratitude, what is something that you are very grateful for right now?
I'm especially grateful to have been able to find a place where I can, in essence, create a space and a job that allows me to feel successfully fulfilled. And I'm very grateful for an administration, a department head, our associate deans and our dean for allowing me to be able to create, to be able to lean in on some of this, to seek out these educational opportunities, these research opportunities, some of these teaching opportunities, and that they have continued to allow us to have our academic freedom and what we develop and create in the way that we feel is best. And that they allow us to come together, talk about what we want and what we want to create, and then help us find the pathways forward, and not everything has a path forward. And that's the reality of the world. But I found there's very few barriers that when you engage with people and you talk with them and you bring people in, that someone can find a way out. And so I'm really lucky to be in a place that allows me to be in the education space, to support really great, amazing research that's being done, to develop myself and hopefully others in that faculty development space and growing and developing as an educator and as a clinician, and then also serve still as a clinician, right? Because for me, I still, even as much as I know I shouldn't, tie so much of my identity to the neurologist side, right? But I've been able to really focus in on epilepsy and seizures, and it's been, as you mentioned, spent a lot of time talking about the art of seizure medicine, and right, how do we take the creative side of medicine, right, and how we recognize there's very little solid answers for this is the only way to do something that actually does not exist a lot in that. But how do you get comfortable living in that gray space? And I think that's the true art of practicing medicine. And so again, I'm just so thankful to have bosses and supervisors that give me the space to teach, practice, and create.
That was Dr. Ryan Gibson. And he said that living in the gray space, accepting that there is very rarely only one right answer in medicine, is the true art of practicing. I think that applies to careers too. There is no one right shape for a life in veterinary medicine. You get to discover what allows you to thrive. If you are curious about veterinary neurology, veterinary education, or the consulting model Ryan has built to support pets and families who can't refer traditionally, links are all in the show notes. For the key takeaways and reflection questions from today's conversation, head over to the Sprinkle of Wisdom Substack for the Podcast Club Guide. Please subscribe and share this episode with someone in veterinary medicine who might appreciate it. You might just open a door they didn't know was there. And until next time, keep reimagining what's possible in veterinary life.